In this module will review central venous catheterization of the subclavian vein using the infraclavicular approach. This technique is appropriate for adults and older children. The preferred side is the right side for a right-handed operator and the left side for a left-handed operator. In terms of the position of the patient is placed 25 degrees head down position. You slightly extend the patient's clavicular area with a small towel placed between the shoulders. You rotate the patient's head away from the procedure, and you position with both arms at the same side. The operator stands at the side of the bed on the same side as the insertion site, in this case the right side. Your anatomical landmarks for this is the mid-clavicular point, feeling the sternal notch, its end, which would be approximately here, drawing a line. The suprasternal notch, and the triangle formed by the sternal and clavicular heads of the sternomastoid muscle with the upper border of the clavicle, which is right here. The point of insertion lies approximately 1 centimeter below the midpoint of the lower border of the clavicle in the adults, which would be approximately right here. You place the point of the seeker needle at the entry site on the skin and point the needle and the syringe towards the head. Then swing the syringe laterally so that the needle and syringe points immediately towards the small triangle formed by the sternal and clavicular attachments of the sternomastoid muscle and the upper border of the clavicle. If this landmark is not clearly defined, point the needle towards the suprasternal notch, keeping a finger in the tip of the notch to act as a target, such as here. Advance the needle posterior to the clavicle, keeping close to the posterior aspect, maintaining the needle and syringe parallel to the coronal plane, as such. Maintain a slight negative pressure in the syringe as the needle is advanced. If the initial attempt fails, withdraw the needle and direct subsequent attempts gradually more laterally or medially of the initial insertion direction, taking it all the way back out to the subcutaneous tissue. This is the infraclavicular approach to the subclavian vein.